Hello, everyone. Today we have an interesting case of membranous nephropathy. We are going to discuss. Um, this is a 56-year-old lady who was found to have a nephrotic range of proteinuria with a protein of 5.2 grams in the 24-hour measurements. Her creatinine was normal, 0.8 milligram per deciliter, serum albumin 3.2. She underwent a kidney biopsy that was consistent with membranous nephropathy, I think was stage 2, and her anti-blur antibody was positive both in the serum and in the tissue. And the question is, all of the following is correct regarding her condition except, okay? So we need to find the wrong statement. Membranous nephropathy is most common cause of nephrotic syndrome in Caucasian and older adults, or mostly membranous nephropathy is primary or idiopathic, although about 20% of cases are secondary to cancer, infection, autoimmune disease, or drugs. Or the wrong answer would be familial membranous nephropathy has been described, but it's rare, or it is characterized by presence of immune complexes in the subepithelial space, or antibodies to antiphospholipase E2 receptors have been identified in only 50% of patients with idiopathic membranous nephropathy. Which one of these statements is incorrect? And the incorrect statement is the last one. Autoantibodies to phospholipase E2 receptor antibody have been identified, of course, in more than 50%, not only 50%, but much more than that. So the first statement was correct that membranous nephropathy is most common cause of nephrotic syndrome in Caucasian, in white person, and older adults. And it's seen more often in men compared to women. It's rare in children, and primary forms constitute about 80%, while secondary membranous nephropathy is present in about 20% of cases, usually either secondary to cancer, especially in elderly, secondary to infection, especially hepatitis B, and less likely hepatitis C or HIV, autoimmune diseases like lupus, and drug-induced membranous nephropathy like non-steroidal anti-inflammatory drugs, penicillamine, and gold. Familial membranous nephropathy has been described, but it's rare, not like FSGS. Familial forms are much common. Membranous nephropathy is characterized by development of immune complexes in the subepithelial space, which is a subpodocyte space, the other description or name of it. In primary forms, immune deposits likely develop in situ. So the antigen, there is autoantigen, which is a phospholipase E2 antigen in the podocyte. Then the antibodies, which is usually IgG4, start to form antigen-antibody complex in the capillary wall. And the immune deposits consist mainly of IgG, predominantly IgG4, some complement, especially complement 3 and 5b to 9. It leads to podocyte injury and cause increased production of extracellular matrix protein along with the glomerular-basement membrane, and results in the characteristic thickening of the GBM. Antibodies to the M-type phospholipase E2 receptors have been identified in more than 70%, close to 80% of patients with idiopathic forms. This is the right answer, not 50%. But overall, primary and secondary cases maybe is down to 50, but in idiopathic form, it's much more common to see positive antiphospholipase E2 antibody. So presence of this antibody indicates mostly that this is an idiopathic form, not a secondary form. However, it can be positive in a small portion of patients with secondary forms, especially with malignancies. Antibody level may correlate with disease activity and help identify patients suitable for immunosuppression. And of course, immunological remission precede clinical remission. Antiphospholipase E2 receptor antibody are typically not found in secondary cases of membranous nephropathy, but presence of this antibody usually indicate primary forms. However, a small portion can happen in secondary forms. Here are the references. This is a recently published article on the pathogenesis of the glomerulonephritis, especially focusing on bench to bedside, pathogenesis of membranous nephropathy in our patient. And thank you so much, and have a good rest of your day.